Jennifer, the reason why you came on the show is you just don't want your child to die in vain. You want there to be some type of instruction, some lesson, some type of good impact from his unfortunate passing, right?
Correct. It was what saved me, and it's part of my grief process to be involved in activism, so no other parent has to go through this.
And we appreciate that. Now I want to bring in Dr. Carlos Tirado, who is board certified in addiction psychiatry and addiction medicine. Dr. Tirado, Jennifer said that her son Quincy had to be on Suboxone, right? Some don't have to be, some have to stay on it. Why is it so hard?
What's hard is that once a person has become addicted to opioids, it's not really a matter of just turning it off. You can't just flip a switch and decide that you're not addicted to opioids anymore. Most people who become addicted to opioids struggle for years. In fact, we see addiction as a chronic relapsing and remitting disorder. And without appropriate treatment, without medication therapy, in the case of opioid use disorder, it can be incredibly difficult for someone to engage the types of changes they need to make simply because they're in a state of almost incapacity at times from the disabling symptoms of opioid withdrawal.
And buprenorphine, how does that actually work?
Buprenorphine works because it attaches to the same receptors that the other opioids attach to. So it essentially, because it's very long acting and it has a very high affinity for the opioid receptors in your central nervous system, taking a single daily dose can keep you from being disabled from withdrawal sickness. It can also help with your mood, and it can essentially help you return to a normal, stable life while you're taking the medication. The vast majority of people don't take opioids to get high, okay? When you're in that space, chronically addicted, you become hooked on these drugs, you're taking opioids just to maintain a sense of normalcy, okay? We still don't know exactly what all the underlying physiology is as to why that happens, but we know that there are basically long-standing changes in your nervous system that make it practically impossible for some people to return to a normal state of functioning unless they have some form of opioid substitution.
Sure, and the common name, people at home may not recognize the name we're using, but the common name is Suboxone, right?
That's right.
Which is a common name. So let's talk about these X waivers. In order for providers to give it, they need an X waiver, and a lot of places deny people being on it because they don't want to go through the X waiver process. Explain that to me.
If a doctor, and now a nurse practitioner or physician assistant even, if they want to prescribe the medication, they have to register with the DEA. They have to undergo a certain amount of continuing medical education training. For doctors, it's 8 hours. For nurse practitioners and PAs, it's 24 hours. And then at that point, if they get the X waiver, you're in a registry, and then you can only treat a certain number of patients underneath that registry. The maximum that any single practitioner can treat, if you can believe this, is 275 patients. Those of us who have been doing this for years actually find an incredible amount of success and it's a great reward actually from treating people with these conditions with buprenorphine. But for most physicians and most physician practices, because of those regulatory burdens, it's often a negative incentive.